This session brought together Electrology and aesthetics, diving into skincare, post-inflammatory hyperpigmentation, and strategies for optimizing client outcomes. So tonight and next week, we've had some special guests, but this week I get to interview Miss Jessica Poole. I got to meet you, a few years ago at one of the advanced electrology seminars. And I quickly realized that you and I have very similar social media goofball personalities. It's like our way of capturing people for our education. And when Joanie told me that you often come out to the school and do a little bit of guest teaching and that kind of stuff, I thought that was kind of cool to have some different perspectives. But then she told me that with your background in aesthetics, that you like to focus on post-inflammatory hyperpigmentation, which I thought would be a wonderful opportunity for us to talk tonight. So while I could introduce you, how about we take this moment for you to introduce yourself and talk a little bit about Ageless by Jessica and your vision for your girls at your office, and then we can jump into the Q&A.
Oh my gosh. Okay. So I've been an esthetician for about 22 years. And then I'm also an electrologist. And I got into the field, I got into the aesthetic world quite by accident. I was a personal trainer, and one of my clients went to a plastic surgeon, and he was looking for a bilingual speaker. And so she came to me and she was like, hey, they're interviewing for a bilingual person. You should go check it out. So I went there and they literally hired me on the spot. And I knew nothing about aesthetics at all or plastic surgery. And then he was the one that told me to go to school to be an esthetician. And then that's how I became an esthetician. And then probably 12 years ago, I started working for PCA Skin and Alta MD as an advanced educator for them. So I travel the United States and I teach about chemical peels and hyperpigmentation, acne, sensitive skin, and all of that. And then here I am with my two offices, one in Fresno and then one in Newport Beach. That's kind of how I got here. But me personally, I suffered from acne since I was like 11. So as far as all that went, I was very interested in skin.
That is really cool. I didn't know you were bilingual. What is your second language? Spanish, like 100%?
Well, so I moved there.
You got through to a different one because they were like, oh,
no, I mean, I can speak it, but there's like topics, because I would say like there's groups of words and there's groups of words I don't know, if you know what I'm saying. Like if we were to talk about welding, I don't know that I would know those words, you know. No. So yeah.
That's awesome. So I also love the world of fitness and that kind of stuff. And I think that's what you and I started talking about originally. But I think that that's a really cool how Jessica became Ageless by. I love our industry and how it kind of captures people through just an interesting treatment style. Interestingly enough, years ago, I'm not even an esthetician, but because my family's med spa, I ended up getting certified in PCA skincare because PCA was based out of Arizona. And I have sat through many of those PCA classes, and it was a game changer for my PCOS skincare. And I haven't used it in recent years. I switched to something else in recent years. But I will tell you that it changed my cystic acne and my post-inflammatory hyperpigmentation that I would get because I have tan skin. So that's pretty amazing. Very cool. And how many girls do you have working at the office now? I know that your daughter's there because I got to meet her at the last convention.
I have my two daughters, and then we have Ceciliana, and then Mariah and Sarah. And then hopefully Saturday, Kiana passes state board, or Friday, and we have Kiana.
Okay.
That will be awesome if that happens.
Oh, wow. And are they all just electrologists? And when I say just, everybody understand that just does not mean just
Yeah, they're all electrologists. Yes.
Okay.
No S.
Okay.
Mhm.
No, it's very
No.
cool.
Yeah.
Well, I know that we have an hour to pick your brain. And I want to take this time to really focus in a little bit about your journey as an electrologist and esthetician, but like really developing that specialty in the post-inflammatory hyperpigmentation and pigmentation changes that you had seen in the field. So let's start there. I know how you got to where you are as a technician, but let's talk about like what made you lean in on pigmentation issues.
I think primarily for myself, selfishly, it was because I had acne and I had really severe acne since I was 11 and I was on Accutane twice. And so I had a lot of scarring, like textural concerns. I've had a lot of laser too. But the post inflammatory hyperpigmentation was obviously a real concern for myself. And so, and then obviously, as I became an esthetician and then clients, and then working in the plastic surgery office and anything from hormones to sun damage, or post inflammatory hyperpigmentation. I would say pigmentation is probably the number one concern with most people.
Just a couple weeks ago when Joanne and I were on the call right before you guys hopped on, I still get that fun cystic acne because of my PCOS along my chin, even though it's much better because of being on spironolactone. We were laughing because I ended up with like two very large brown dots, and they are now there for the foreseeable future because it takes my skin forever for that to go away. So I when it comes to pigmentation, I get that for sure, especially when it comes to acne. What would you say um, are the things that are like particularly those arising from like irritation and healing when it comes to PIH, post-inflammatory hyperpigmentation? For those that don't know the acronym, you're probably going to hear me say PIH from now on because otherwise it's going to be a long sentence. Um, what would you say like you started focusing on when it came to addressing skin pigmentation? Was it from the component of in-house services, or was it home care that you started really educating people on? Um, I know that just like the gym, it's not necessarily the hour that you spend in the gym or on the table when it comes to chemical peel. It's usually what happens at home. But what did you feel was the big fact um, in your education for your clients?
I always tell people if nothing else, they need home care because I like to say it's consistency over time that creates change.
Mm.
It's just like going to the gym. You can go to the gym once, like you could come in for a chemical peel one time and you can have a treatment, but that doesn't really create the change that we're looking for. We need that consistency over time. And so it's really about home care and that consistency day in and day out of treating our skin, whether it's sunscreen, moisturizer, or some sort of pigment suppressor.
Uh, I guess let's talk a little bit about understanding PIH because I think that a lot of new electrologists might not have faced this uh, as a practitioner, and then established ones might not have heard it from this perspective. So, what would you say some of the most common causes of PIH are in patients receiving electrology treatments?
So with electrolysis, just like laser or a chemical peel, I like to call it a controlled injury.
Mhm.
And so we are creating an injury in the skin. And when we have an injury in the skin, that triggers a response, an inflammatory response in the skin. And that inflammatory response then can cause hyperpigmentation if we do not um, treat our skin correctly after having that controlled injury. So, things like moisturizing the skin afterwards and SPF and possibly doing a chemical peel, maybe not with electrolysis so much, but those types of things we need to be doing after electrolysis to help control that injury response.
That is, so one of the things that I think about, I call it controlled trauma. So it's controlled injury, controlled trauma. Uh, we, I think educating our clients to understand that home care during electrolysis, even if you're not an esthetician, as something as simple as having a gentle cleanser, a moisturizer, and an SPF, I call them the trifecta, right? So like those three items can really change the outcome of clients' skin. Would you say that outside of those three, that if you're not an esthetician, is there anything that people that aren't Etsy's would need to include on top of that? Or would you
Those three.
yeah.
Well, I definitely, I will pick two of those for sure. Just side story. The moisturizer, I think number one, because anytime we have controlled injury, we definitely need to moisturize afterward just to help, restore the barrier of the skin and then obviously SPF. But I would say some sort of pigment suppressor, whether my favorite is B3, which is niacinamide. And I would say anywhere between a 4 and a 6%. Obviously, PCA makes one. So I do love that. But I'm sure there's others out there, but you do need a high concentration. Like you don't want to just have a moisturizer that just happens to have niacinamide. You do want something between a 4 and a 6%. Tranexamic acid, licorice root, oh my gosh, my brain is malic, all of those different pigment suppressors. I mean, anything is better than nothing. But I definitely love niacinamide particularly or B3 because it does several things. It suppresses pigment, it restores the barrier of the skin, and it decreases inflammation. Those are other aspects of what niacinamide slash B3 does. And so, especially with electrolysis, we are impairing that barrier. We are creating inflammation. And so, niacinamide, particularly B3, it helps control all those different aspects. So it's one of my favorite ingredients when it comes to electrolysis.
Have you used products? One of our members is asking about arbutin when it
That's
comes
a pretty great pigment suppressing ingredient as well. Yeah.
safe for electrolysis here in the States too. Yeah,
Mhm.
that's awesome. Now, when we come to those like favorite products, do you have any products that you're like, if you're doing electrolysis and this is in your skincare regimen, full stop, because it's going to get you right to hyperpigmentation issues. I always tell my clients like corrective care, unless you're working with an esthetician that knows what you're going through, corrective care during electrolysis can be a little risky. Um, Corrective skincare, I should say.
For
Uh,
sure.
but I know that there are plenty of Etsy's out there that will do it. It just seems that it's like a little bit of like counterproductive. Would you agree with that? Because I don't want to speak outside of my scope, but that is your scope. So
I mean, I do kind of do both
I,
and for myself. However, specifically retinol
mm,
can be super irritating. And with electrolysis, we would never want to apply it within 5 to 7 days of a treatment, especially if we had some major work done, because it could actually burn the skin on top of that trauma. So then that could cause hyperpigmentation.
oh my gosh, and the drying out of that tissue, and
Yeah.
yeah,
Well, that's just it. Because pigment can be created from dryness. It can be created from chafing. It can be a chemical peel. It could be a laser. It could be the sun. It literally could be anything. So, especially after electrolysis, all that dryness, we would not want to use anything that would be any more irritating or drying that could then cause hyperpigmentation.
exactly. It's not a tattoo. It's not like you're trying to dry heal it. You've got to put that moisture back in and repair that barrier.
Mhm.
What inspired you to focus? Um, Oops, wrong word. Huh? That's a question we've already asked. You're welcome, everybody. Welcome to Tuesday evening. um, so, can you explain how inflammation during or after treatment causes that pigmentation change? That's the main focus when we're trying to understand. Now we know the initial setup of it, but what's that trigger pigmentation component outside of that?
This episode is sponsored by Silhouette Tone, a global leader in electrolysis equipment and aesthetic technology. From advanced epilators to full spa solutions, Silhouette Tone empowers professionals to deliver safe, effective treatments with innovation at every step. Discover their electrolysis equipment and more at silhouettetone.us.
I had like brain fog one more time. I was like,
That's okay. Don't worry, everybody. This is good. It's not just me, and that's important. So, how would you explain how inflammation during and after treatment triggers that pigmentation change? It's like on a very detailed scale, as if I was coming to you because of my pigmentation issues. Tell me how I can help.
I mean, I think if I was telling a client, I would just tell them that anytime we create inflammation, so we're introducing heat. And I use the term heat a lot with my clients so they can understand when we're introducing that heat deep inside, we are creating a burn inside the follicle, technically, right?
Mhm.
So if we had that inflammation inside and then we are out in the sun, which can irritate that, or we're not applying moisturizer that can then cause more dryness, that inflammation that's already there is just like 10 times more. It's like exacerbated, right? It's like it's enhanced. And so that can cause hyperpigmentation. And hyperpigmentation is created to actually protect the DNA inside our cells. And so when your body thinks it's under attack, it's going to create that pigment to try to protect itself. So if we are not moisturizing, if we're not using our SPF, then we are going to trigger that response and we're going to have hyperpigmentation. And it doesn't even have to be anything that we as electrologists have done, but it could be our clients at home when they're not moisturizing, if they are using their retinol, if they're using an aloe that has alcohol in it or whatever it may be that can cause that extra trauma and
Mhm.
burn in the skin that would then create the pigment.
And then, like, and this is one of those ones that's always kind of hard to like find the best way to ask it, but because I look at you and myself, like you and me, and we obviously are different, two different variations of melanin, but we're both prone to PIH because of our acne. Would you say that there is a specific skin type or condition that makes people more prone to developing PIH over someone? I mean, when I think about people that might listen to this when when the podcast is released, and I think about like those who might be consumers that are worried about getting hyperpigmentation or the things that they hear on the forums on like Facebook and whatnot, um, that can kind of prepare them for a higher chance or a lower chance, and what would that look like on them? Is it gonna be redness? Is it gonna be brown spots? Is it gonna be a combination of the two? Um, and how does that present itself?
So, obviously, depending on a person's skin type or Fitzpatrick, right? So that scale of 1 to 6. So myself, I'm probably more like a 2. So what's going to be post-inflammatory hyperpigmentation on myself is going to probably look more like reddish purple, right? Versus someone who's maybe a higher Fitzpatrick's, maybe somebody that has like black skin that already produces a lot of melanin. Theirs is going to like purple or black.
Mhm.
And so when um that pigment, when someone already produces a lot of melanin, their skin wants to produce that melanin. And so when they do have an injury response, they're going to be more likely to hyperpigment and for it to stay versus someone who maybe is more of a fits 1, 2. They don't produce as much of that melanin. And so therefore it's not as much of an issue. But when you already are someone that through your skin produces all that pigment, then they're much more likely to have hyperpigmentation from overtreatment or from saying like not using an SPF or moisturizing after treatment.
That's I always have thought, and I think it was at one of my PCA classes where someone said melanin has memory. Uh,
Does.
and it's one of those things where you think about your base tan, and the reason people go for a base tan before they go to the beach is they want to activate that memory of that melanin so that you don't necessarily get to a burn quickly. you can kind of slowly elevate your active melanin. But within that melanin has memory thing, I also think about when our patients are going through that controlled trauma, um, one thing that I faced as a patient in electrology was that I would have the same hairs being zapped and I would have the same 5 polka dots because I did not follow protocol when my mother did my electrolysis. Um, I was a teenager, but it was one of those things where I think about those moments. Um, Someone in the aesthetic world, and I actually have never found this information, and so I'm curious to hear it from you if you know about it. But someone said to me that if you're more like me, like I'm a 4 and I'm a light 4 when I'm like this, and I can get to be a dark 4 on a Fitzpatrick scale, that if I pre-treat my skin, no, I have not done this in the adult years, with SPF day and night, that it kind of builds that barrier and helps protect our skin more. The reason I haven't found it online is I really don't know how to type that. And
So it's more about prepping the skin for trauma,
okay.
right? So it's most people have have an impaired barrier of some sort typically. So if you start moisturizing and you start using SPF, you kind of prep the skin for the trauma that's going to be coming. And then your skin is already moisturized, it's already been protected. And so you are also, when you're protecting it, you're also decreasing the amount of melanin that is present in the skin, right? Because it does slough off and it fades away. So it's not that active production at that moment because you are protecting it so the skin is not constantly under attack from the sun, right? So that's kind of the idea of it. So yeah, definitely prepping with, moisturizer and SPF before we start treatment, I think, or even a pigment suppressor. I mean, that is part of in our office, that is part of our protocol. It is part of our pre-treat paperwork is that they start using niacinamide, they start with SPF, and they do start with a moisturizer.
With the moisturizers and the SPFs that you're using for your patients, are you using a mineral-based SPF or chemical-based SPF? One. And
Mhm.
moisturizer, is it really dependent on their skin type to begin with, or are you utilizing a certain style of moisturization?
Give me 1 second because one of my lights went out and I don't want to go dark.
Oh, no worries. And if anybody has questions and they want to put it in the chat, I can definitely throw
Like, I don't want it to go dark on you. Okay. So the question was,
on SPF. Are we going chemical or mineral for your
okay.
analysis
Yep.
patient?
Yep. So we do have both in our office. We have chemical and we do have mineral. Typically, I would say that if someone is having electrolysis, they probably need a mineral based SPF versus a chemical so that we are not absorbing all of that heat versus reflecting it out with a mineral base. And typically that's another thing when someone tells me that because that happens too, people are like, "Oh, I can't use SPF because I'm sensitive to it."
Mhm.
They're typically sensitive to a chemical SPF. Typically, when it's a mineral SPF, there are no issues with SPF because usually it has something to do with the chemicals and the heat that they are having some sort of reaction. So, and then moisturizer, I mean, for me, really kind of if we're talking texture or heaviness, if that's the question, is really about the person's skin. So
Okay.
if they're already super dry, then they probably really need a really heavy moisturizer. And if there's somebody that's maybe more oily, we probably just need something that's more light, not quite as heavy. So I tend to choose according to their skin type, but then also there is a aspect of it where people have a specific like when it comes to moisturizer. They either like heavy ones, they don't like them to be heavy, they like them to be more sheer, or maybe they like them to be balmy. And so I also do sell them according to texture opinions with the clients. But obviously, if someone is super, super dry, I'm going to push something and when I say heavier, definitely something that has more of an occlusive effect.
Okay. So, and I'm gonna kind of like step in on this moment. So, like, Anita was saying that like mineral-based SPF has a white cast and it's usually thick and not nice on darker skin. I will say that here in the States, we have a company that I had to switch off to myself because I was a sensitive skin person when it came to a chemical SPF, and I went to a mineral base and I was tan at the time. So I had to go and find a bazillion different ones, and I settled with Aven Thermal. They are out of France, and they are a zinc and thermal spring water based brand. And they have one called Solaris that is tinted in like three different variations. They have a very, very dark one. I still see a slight white cast when you first put it on, but it does absorb a bit. And so that's like what, and I just tell people to kind of like, if they powder correct, if it's kind of looking a little too much of a white cast, I go with their medium tone when I do use the tinted one, and I only use the tinted one when I have to talk to you guys in public, like in person, because COVID hit, and Jessica, you're probably gonna laugh so hard at this. I was a everyday makeup wearing, lipstick wearing, eyeliner, not eyeliner, mascara, and then all of a sudden, all I had to do was wear my eyes, and so I stopped wearing foundations. But I switched to their Solaris mineral based. It's like a 50. It's very liquidy, and it does not do the cast at all for me. And I was the person that was like overly looking at that. And I know it's not the only one, but I definitely want you to know that, like, because you're
One of my favorites is PCA and LTMD. Probably gonna
yeah.
kill. But PCA does have one called Sheer Tint, and then LTMD has a lot of mineral-based SPFs as well. But one of my favorites is from Skin Better.
Oh yeah.
It's called Tone Smart, and so it literally adjusts to your skin tone. And I tell you, and it's only one shade. And I tell everybody when you first put it on, you are going to have that moment of like, oh my gosh, OMG, what did I just put on my face? Because it looks super scary. But then it just kind of melts and it fades into like every skin tone.
I'm gonna put, because one of the girls was asking about the brand. Hold on a second here, that I was just talking about, but I can do the same thing for the one that you just talked about as well. So if you type it in the chat, that's one way to do it. And if not, then you can send it to me in the text message and I can send it over if you're like, I have no idea what you're talking about. So first, that's this one. She's like, absolutely not. We will be using text message. So, and this is just like one of
And
the
it's called, hold on, and I'll tell you, it's called Tone Smart.
So, there we go. It's so funny. And I will, just so everybody knows, I will do my best to remember to put this in the show notes, because let's face facts here. I have a bad memory once I get off this call to remember that kind of stuff. So I am making a note as we go about this so that you have this. Okay, so there's the other one. And then one of my Zapplings that I couldn't heard the third prep SPF moisturizer and a gentle cleanser is what I use. But what would you do? Like, what cleanser is your favorite during electrolysis, so that we can keep that skin hydrated and healthy?
So I use one from PCA called Facial Wash. It has a little bit of lactic, and I think when people think acids, they think lactic acid. They think, oh my gosh, like we can't use that. But lactic acid is actually moisturizing.
Mm.
So I do love the lactic acid facial wash, and it's just called Facial Wash from PCA. But one of my favorite ones to sell to electrolysis clients is something called Daily Exfoliant from PCA. And I know when it comes to electrolysis, I really feel that they also need to gently exfoliate their skin, not the day of, obviously, but in the following days after. And daily exfoliant specifically, it does not have a chemical. It is not enzymatic. It is purely a physical exfoliator, and it is gentle enough for them to be able to use every single day. So it is not some crazy exfoliator. It's actually made from a really gentle wood pulp that they can just, and it's 100% biodegradable.
That's awesome.
Yeah.
I miss my PCA. I gotta like get back in contact with my like a rep because that stuff is. I mean, it is liquid gold for a certain.
But they need to be careful with exfoliators. I always get scared when I tell other electrologists that their clients need to use exfoliators because I always worry what they're going to give them. But this really is not a chemical or an enzyme. Yeah.
Don't be doing apricot scrub. I will come down and I will hunt you all down. If you're doing that on your face. No more St. Ives. That St. Ives is not a saint. It is absolutely horrible. I but it's nice to hear that from an esthetician that exfoliation isn't necessarily a bad thing during like
No, we all need to exfoliate, at least once a week. So.
Okay.
Not
no.
just really gentle exfoliator.
Oh my gosh.
Oh yeah, that's my daily exfoliant.
Okay. Yeah. I remember that one.
Yeah.
One of the girls says, St. Ives, but the packaging is so pretty. No. I don't care.
Let me draw you in.
I'm like, okay, go for it. See what happens.
Yeah.
Somebody told me that there's like almond shards in that, and it's just like lacerating your skin. And I was like, no, thank you. The apricot.
We want something with a spherical type B, nothing with sharp edges.
Yes. No premature aging, if at all possible.
Yes.
Now, when it comes to, now we know that skin types that are prone to this, but when it comes to like steps electrologists can take, would you just say that it comes down to consultation? Is like really getting to understand how to advocate the need for like balanced skin? Or, I mean, because obviously we have products that we've talked about. We have that component of it. But how do you, I know people struggle with selling product when they're an electrologist. I also know that if I don't sell it to you, you're going to go to the store and pick out something off the shelf with pretty packaging. And then all of a sudden, I'm going to have a nightmare on my hands. So how do you lean in to get not only yourself, but your girls that work for you who are not estheticians to upsell? In a positive way, not necessarily, I'm not saying like when a client listens to this later, we have to take care of your skin.
Well, I definitely think that people need to hear things or read them multiple times. And so we do have it in our paperwork for pre-treating, something they sign before they ever start treatment. But, we know how much people read. So, whether they actually read it or not is here or there. And then my daughter, she made us a digital consultation book. And so we do have our products built into our consultation slides. And so that we can talk about the things that we do recommend. And then we obviously always, ask them if they are interested in purchasing the daily care products that we recommend for electrolysis. And the truth of the matter is, I always tell people when you're selling products that they can only say no.
Mhm.
I know we're all scared to hear that word, but they can only say no. And if not, they will go home and they will think about it. People often come back and they purchase it. And if you do not recommend, they say that within 24 hours, they will go somewhere and they will buy it themselves somewhere else. So if you're not recommending, they will go look for something somewhere else. And it's probably something you don't want them to be using.
Oh my gosh. And they're going to go online and they're going to say, like, my electrologist didn't say what I should be doing before and after, right? So what do you guys recommend? And now you went to the masses and asked a very open-ended question of which they might end up with products that you strongly disagree with using.
How many times people end up with like moisturizers that have retinols in them or glycolics and things of that nature that first off, they should not be in a moisturizer, but they'll end up with products like that. And they think that they're using something that's good for their skin after electrolysis. And it's actually probably causing irritation and inflammation, which then can lead to our hyperpigmentation.
I mean, stuff like as simple as people going after electrolysis and putting, what is this? The skin barrier after, if not Desitin, but the ointment Aquaphor,
Oh, yeah.
or it's like that stuff's very thick, and I'm grateful that you're moisturizing, but at the same time, I just put a bunch of heat in there, and now you're putting an ointment. That
And I think that's a big one too, is that they need to understand when it's appropriate to apply these products. And definitely after treatment, I always tell them that we want their face may feel, depending on how much work they have, they may have that sunburny kind of hot feeling. And we need to wait for that to completely dissipate before we apply our moisturizer. That might be tonight, it might be tomorrow. Whatever that is the time that we need to wait before we are applying moisturizer, because if not, we are sealing in all that heat, which can then just create more trauma.
Oh, yeah. When I was a high schooler, I had dropped a curling iron on my chest as I was flat ironing my hair. And my friend said, "Don't worry." My grandma said, "If I put butter on this, it'll help." Fresh burn, high school kid, not thinking anything about it. And I sealed in that burn very efficiently. And then it took forever for that line to go away. In fact, I think sometimes if I get a good tan across my décolleté, you'll still see a slight line over my left side where it dropped. And I mean, we are way past high school age for me. So it's been a minute when that happens. And I think that same thing when it comes to when I was a kid going to Rocky Point, I had the sunburn of my lifetime on the outside portions of my tricep, like bicep to tricep area. I actually have an equal line that goes down the sides of my arm because of where the sun was hitting me and getting that severe burn. And that to this day stays there. And that's why I say melanin has memory,
Those cells have memory.
and it's there. And so taking care of it by utilizing products that will protect, heal, repair is so important.
If someone already suffers from hyperpigmentation, so let's just say maybe melasma,
Oof, okay.
they are working on their face, they definitely even more so need to really make sure that they are moisturizing and protecting afterwards. Because again, we could trigger that response just with the heat. And then them for sure they need a mineral based SPF.
Based. Yeah, and that's a hard part because like if you think about melasma, and another word for that, if for those who don't know, is like pregnancy mask. It's that brown hue that a lot of people will get throughout the beard line area and across. And the lip is a very common area. And often people are thinking that they're seeing shadow from hair growth, and really they have a slight cast in those spaces. And that's what we're referring to here. I think that it's really important for people to understand that like this is a controlled trauma, it's a controlled injury, and we can make that worse for them in those moments. Um, do you find that like a melasma-based patient or someone that has like rosacea, for example, like that just that reddening in that area, post-treatment about like ice and that kind of stuff, is there anything that that an electrologist could be helping send them home with in those spaces? Or is it pretty much like the product itself is doing the work, not necessarily the cooling of it?
So we have ice makers here in our office, and we do send them home with ice or immediately after to help reduce that inflammation. And across the board, all clients, we offer them ice after treatment just to help really take down that inflammation, the heat, and the redness. But for sure, I would definitely offer them ice, or even, when they're home, ice globes. Those are really hot and trendy right now. Something that can be washed.
Yeah.
Yeah.
Good point.
It's free. And then, used again later if they needed to.
When someone does have that for home care, what would you say is the best way to cleanse those?
I would just, you could even take your facial wash if you wanted to and wash them off. Or, I mean, if you had to, your dish soap, but I don't really love dish soap. But, I would say like a facial wash for
Right.
sure.
I forgot my SPF, not my SPF, my wash when I went to Phoenix this last week. And then I went down my family's practice and I was like, I gotta get washed, right? I use the hotel shampoo. I know this is why I'm an electrologist, not an esthetician, because I cannot be trusted. I'm like, it's soapy. Let's go.
I don't know if I could do that.
It was a little
The anxiety.
And it's like one of those, I mean, I went back to my regular cleanser once I picked it up from their office, and I was just like, "I got this, don't worry."
I still feel like it was like drying out like a raisin. Like,
Oh my gosh, yes, and it was like it had, I was like, "Well, it's 0. It has, like, 0 parabens and 0 sulfates," and, like, I was like, "It's gonna be fine," and I was so in fact, my upper lip is still chapped a little bit. Um, just ladies and gentlemen, if you're listening to this later.
you said
Uh,
often it drew me to one more thing too. Benzoyl peroxide face wash. So obviously can be super drying. If
yes.
someone is having electrolysis and they are using a benzoyl peroxide, maybe they don't use it for 4 or 5 days after their electrolysis treatment, depending on obviously how much electrolysis they're having done. But because that can be super drying and irritating.
Oh my gosh, it can chap your skin really quickly too. I one of the things I would tell my patients when I was back in Phoenix was like, when you get in the car, of course I want you to have this ice, but like blast that AC. Let's let's give ourselves a cooling treatment, which can be kind of a pain when you're in a hot weather area because it might take a few minutes for your car to cool down. So you have to be kind of careful because like that's the prime time to cool yourself is like when the injury first happens. Um, so proactive patient management is one of those ones that I think is really important for us to kind of like get into. And in the last little bit of this conversation, I want to focus on that and as well as like some parting thoughts. And if anybody has any additional questions, we can definitely open up the Q&A. But would you say that when it comes to like patient management, um, what are the methods that you're doing to assess the patient's skin before beginning treatment to identify for risks for pigmentation issues? Like, what are you looking for?
Um, well, a lot of times I'm looking at their skin, seeing what they're already doing.
Okay.
So basically their paperwork, I look at their paperwork, see what they possibly may be using, not using, are they currently seeing an esthetician? Are they not seeing an esthetician? What products are they using? Are they not, maybe using that would be an issue or maybe what they're not using that they need to be using. And
Mhm.
then, as you know, people who are pluckers, are we already seeing hyperpigmentation? Are we already seeing some of those pigmentation responses already in their skin? And in that case, we need to be even more proactive because here we are going to be treating already on top of injured skin. So, that would be for me, that would be a big one. And then if they are seeing an SD, are they having chemical peels, depending again on their Fitzpatrick? Because we did have a client here that she was like a Fitz 5, 6-ish, and she was seeing an SD and they were doing chemical peels. And she called me one day and she was like, "Hey, I'm scheduled for treatment tomorrow, but my face is still peeling." And I was absolutely not. You cannot come in.
Yeah.
And so that is, they have to make that decision and choice at that time what they're going to be doing. It's electrolysis or it's chemical peels.
Right. You don't get to do both in that minute. And like, I look at it this way until you're out of the thick of it when it comes to electrolysis, doing chemical peels or resurfacing treatments in general are difficult during that time frame because the gaps that you have to
Like
take.
they have the time.
Yeah. I mean, that's hard. I always say, like, do you have at least 4 weeks between the 2 procedures?
This season, Electrolysis Unplugged is spotlighting our groundbreaking research project. We're working to bring legitimacy, data, and recognition back to electrology. If you're a practitioner ready to contribute detailed charting and client outcomes, or a student interested in learning the process, visit electrologycoalition.com, look under research, and get involved today. Together, we're writing the future of electrolysis.
And that
And I think one too thing is like just so that we are clear here, like sometimes people will say, "Oh, well, I get chemical peels on my face, but you're going to be doing my underarms. Is that an issue?" Like, no, obviously not. Those are the questions you get. So yeah, I mean, if it's a completely different area, we don't care. But face specifically, or maybe back even. Some people get back facials and peels.
I definitely what I tell my patients, like, if it's a chemical peel and it's a different area, no big deal. But when we activate the melanin through sun exposure, your skin is the largest organ, right? And so you're activating that melanin everywhere, which is why you can get hyperpigmentation on your arm or underarm when you might have only had your face out and got burnt there. It's just because your body kind of like pulls it up. So just to protect themselves, like if it's exposed skin, even if it's a dusting of a small like spray SPF, I feel like that's the bare minimum that we could be doing in those spaces.
For sure.
Usually it's the adjacent areas that are problematic in that, not necessarily like such big differences.
I think people do a lot of touching of their face and areas, and then that can cause inflammation. You know, I was like, keep your hands off, keep your hands off, keep your hands off, don't touch.
Oh
Yeah.
yeah. The frequency of having to kind of push away the hand to kind of come up and I'm like,
They want me like,
and I am very guilty of a lot of bad habits when it comes to my skin. And I try my best not to have them because of my acne background. But like, I think that I will always forgive a patient for like getting a little bit their hands in an area. But I also want them to know that if they come back and they complain to me that happened, but we had that discussion multiple times, those are those hard lessons learned by the patient in the moment. And that's like one of those moments like that, yeah, that really sucks. And I'm really sorry that happened. This is why I said those things. And this is how we could mitigate that happening in the future. Um,
I think too that one thing that I really try to teach the girls here is that, when we are done with treatment, just reiterating some of those precautionary tells, let's not get any hot tubs, steam rooms, saunas, don't be laying out in the sun, wear your SPF, you need to ice. I think just reiterate, because it is a constant education process with clients, as much as we want to think that our consultations are like gospel and they just somehow ingrained it all into their brain and they remember it all. They do not. And so we do constantly need to educate. And even if, we know we went over it, they're probably not going to remember it from consultation. I know in our office too, we made up little cards that are post electrolysis cards that we give our clients. Like, just like, here's a card for your post care things to do or not to do after treatment. Just one more piece of something to give them to try to help in the process.
I was actually thinking recently because one of my students over the summer showed me this really cool card that her permanent makeup artist had given her. And it was like basically like a business card size of it. And it was the 6 steps they want them to do after their permanent makeup. And I thought, how great would that be to be able to send you home with a magnet that you put on your fridge or some type of like, you're going to put this up on your mirror at home is a reminder of things that we're going to be working with. Um, and as I can't get myself to just come down with 6 things. And so while the card was cute, I'm still kind of like consolidating the before and after protocols that are like, I'll tell people that there might be 20 things on this list, but I want you to focus on 3. And that's a hard one. But I think that is important
Maybe
for
like 3 do's and 3 don'ts, like cleanse, moisturize, SPF, and don't lay out in the sun. Don't,
right.
you know.
Like, yeah, it's a hard one. Keeping it simple is very important because you are going to do constant consults their whole life with you. And that's okay. I need constant consults too.
It's like I had a skincare client that I've been seeing her for like 3 years, and recently she goes, "I didn't know you weren't supposed to work out after." And I'm like,
I'm like,
"I've literally been seeing you every month for a chemical peel, and you didn't know you can't work out the day up." Like, I don't know how many times I've said that.
Uh, I always tell people no friction-based activities when we're doing something that creates heat in an area because it's gonna be like, especially when I was bodybuilding, right? I would have friends that in my bodybuilding group that would come in, and they would come from, like, hiking Payastoa, which is, like, basically a stair stepper of a mountain out in Arizona. And then I'd see them at the gym in the morning, we go lift, they go do their cardio on Payastoa, and then come see me for a laser. And I'm like, "Listen, I need you to understand that when I say friction-based activities, hiking a stair stepper mountain or going to spin class, or I don't know, Pilates.
Hot yoga here is a big thing.
Hot yoga, yes. I'm like it's hard on the areas that I'm working, and if you're getting all sweaty and they're like, "But it's just laser." It's in those moments, and it's like, "Just laser. I'm using a class 4 medical device on you that is regulated heavily, and these are my basic protocols." And years ago, I had a good friend of mine that, I accidentally overtreated because they just didn't, I didn't recognize how much sun they had, and they didn't recognize that the sun was more than what they'd had in the past, and it was like this mutual problem where, I mean, eventually we came to a point where we were able to correct it as much as possible, but nobody wants to see that happen to somebody, and the freckling that you can get with electrolysis on those hyperpigmented spots, PIH takes a
A
long
long
time.
time. It could be years.
Yeah. I mean, I definitely the only hyperpigmentation I've gotten that's, like, not technically PIH, it was I that wasn't PIH was across my forehead as a kid. Just getting, like, my laser done across my forehead and ended up with cheetah's print, and it took a lot of work to get it off there. I did. I mean, I don't even have, like, the memory
Does
portion of
that
it.
end now? Because I was gonna say we do maybe microneedle it to kind of break it up.
Oh, yeah. No, 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 it doesn't show up now, thankfully, because it was very much like a line across my forehead of spots where we were trying to detach my eyebrows from my hairline. And it was I mean, that's the thing is, like, I'm Italian, guys, and so it just started at the top of my head and kept going, and it's one of those things that e even with a mother who worked in the industry before I did, you think that you're, invincible. And
Mhm.
you're just not.
Not gonna happen to me.
Did it? Oh, no, no, sorry.
And that's what people think, it's not gonna happen to me.
Um, Anita says, "NFC stickers with all the aftercare to go straight to the phone." We do QR codes so that they can scan them on the way out the door, but that's if they save it, and then I'm trying to find that way to, like, I don't know, make me your little best friend, credit card size that goes into your wallet, that every time you have to pull out your credit card, you are reminded, that Stephanie also would like you to, take care of your skin, so the next time you use that card at the office.
Have any in here, but that's like the size of ours. They look like a little business card. They're just
Oh.
that yeah.
That's it. I mean, microneedling with the fits, Patrick, above 5 is okay. That's a question here. I think it will give more PIH. What do you think on that
I
scenario?
mean, I think if it was a really gentle microneedling, we're not talking about major ablation. We're talking like just some maybe like one pass of microneedling, super gentle, and then, giving it a good 6 weeks before we do it again. So it's not something that we're wanting to like just really ablate the area. We're just wanting to do a gentle pass just to kind of try to break it up, not create more trauma.
Yeah. I mean, to me, microneedling, as long as it's just like pixelation,
Mhm.
because I used to perform, basically RF microneedling. I was doing sublative treatments for my patients, and that was a huge benefit for them, but you also have to be really careful because if you're putting that much heat into the area, you have to really keep it light. The
Yeah.
more the more depth that you're getting, the more you're trying to go for, like, the rejuvenation of the collagen and elastin and getting that penetration depth,
I think if someone was like a fit 6, I don't know that I would do RF to try to break up the pigment.
no. No,
Yeah.
no. I
I would
think,
just
my
like
most was like an R 4.
yeah.
Yeah. Okay, so, uh, what do you think is the biggest misconception electrologists might have about treating or preventing this? Oh, it might
Hyperpigmentation?
yeah, PIH and hyperpigmentation.
The biggest misconception I was gonna say is probably gonna be it won't happen to me as an electrologist, that I'm not gonna do that to someone. But I think that, I mean, we had it happen here in our own practice. One of my new electrologists, I kept telling her that she needed to increase power, and instead she inserted in the same follicles like 15 times, right? And the person was like, if it's 5, and then she had hyperpigmentation all here. And I was like, but if you had just increased the heat and got it out in one tap, then we would not be in this situation. So, I mean, I think that knowing respectively, like how much heat to use to get something because over treatment is also inserting time and time again. It doesn't just have to be power, right?
Yeah.
Because we can use too much power and overtreat someone, but we can also insert 15 times and not be overtreatment at the same time, right? So knowing, how much power you can use, but also, I just think we need to know that we can cause hyperpigmentation and we need to be giving our clients the tools to prevent it at home, obviously, and after treatment. And if it does happen, you have to own it.
You really do.
Yeah.
It's one of the ones I really struggle with when I'm teaching, especially when I was teaching the laser component with my electrologist more, is that people come in and they're like, oh, well, laser hyperpigmented people, electrolysis never does. And I'm like, injury is injury. It's just the spot in which you're injuring somebody that changes. And if you're not allowing for thermal relaxation time to occur, you're just building that heat up in that tissue, and it takes a long time to dissipate so that skin can recover. So if you hit, even if I was at, and I'm going to use just, we're thinking on a scale of 1 to 100, okay? We're not going off of real levels here, okay? Just understand I'm saying percentages. If you hit the same hair at 10%, 10 times to get to 100, or you hit the hair at 100 one time, it is still at 100, but the problem is by building it over time, you just don't know when you have given just enough. And often people go, and I say 1 to 100, they focus on the intensity of the machine and not so much the timing, right? They're like, I'm going to get this to 100, but I'm going to do it really fast. And some skin doesn't handle that well. I mean, as you guys know, I do a lot of multi-needle in my practice, and that's one of those things that some people handle currents differently, and their skin does as well, and that's important to think about. Before we leave tonight, and I really want to say thank you for being here tonight because I know that Joanie left us for overseas for the week. So thank you for that. I want to say if you could give outside of don't think that you can't do something, and like on that advice, what would be the next piece of advice you'd give electrologists wanting to improve their patient outcome on on hyperpigmentation or hypopigmentation, because that's also a very key component here.
So what was
What's the big piece of advice, your takeaway from today? If somebody could incorporate one thing into their practice tomorrow, wave that magic wand and it's a new thing that they get to do.
I mean, and sell SPF.
Sell SPF? Okay, got it.
I mean, seriously, protecting that skin after treatment is going to be everything. So I definitely selling SPF. And I mean, secondly, I would say give them ice and sell moisturizer. I mean, moisturizer, SPF, ice. I mean, nothing crazy, but just that really calming, soothing aftercare, nothing that's going to create more trauma in the skin. Yeah.
Agreed. It doesn't, I mean, I have this like dream of mine that like one day I'll have like all this ample time. I'll go back to school for aesthetics and stop treating my skin the way I do it. But I think that there is something to be said for you don't have to be an esthetician to understand how to healthily take care of your client's skin and advocate for that. And I think keeping it simple with basic products, SPF and moisturizer being two of the most simple things. You can get ice a lot of places.
It's ice makers on Amazon for like $50.
I know they're so good too, for many reasons. But yeah, I mean, keeping it simple like that, I think is a very important factor. So
Yeah. It definitely, SPF would be my number one across the board.
Across the board. Well, my dear, until we bug you for another moment next time, I want to say thank you one more time. Everybody, if you want to drop that in the chat and say the same, that's awesome. But we really appreciate you dedicating an hour to um, our members and people who want to get better at being kick butt zappers. So thank you for being here.
Yeah, thank you for having me.
It is very awesome to have you here. All right, everybody. Until next week. Next week's going to be an early one as well. So 4:30 p.m. Pacific Standard Time for the live class. I will get this uploaded as soon as I can. And I will talk to you guys next week. We have laser and electrolysis being discussed next week with Karine from Silhouette Tone. She's a trainer there. And then we also have the 15th of December, my laser and electrology 2-hour lecture, and talking about the incorporation of those two. So if you guys have any questions that you want me to incorporate in how I did today by our little interview, you can drop them in our email or on your membership access, and we can put that in the grilling of our people, the interviewing. So,
all right. Thank you.
Bye. Everybody.
Thank you for bridging the gap between skin health and electrology practice with us today.